looking at the family file and you're trying to locate a patient, it's just simply this little arrow that's pointing to finding a patient. There's another little button we'll use when you add a family member, but it's very critical that we start with adding a family. Now, I'm going to go ahead and enter the last name of my family, which is me, Lisa Davis. First thing we're looking for, am I in the data? I am not. Looking at the patients, because I'm not here, there's a little button called New Family. I am going to be a new family with this blank data screen. I simply need to fill in the correct information. The most important thing that's critical, and this is something to make a note on, you must enter the head of household first. If you have a child come in and they're 8 and you create a family file for that child who is 8, they will get the billing, they'll be the responsible party, they'll be the guarantor. So make sure you put in the head of household, which is typically a parent, a husband, or a wife. So, my name, I prefer to be called Lisa. Salutation is simply a little category that if you're going to send special letters or correspondence and you want to put, Dear Lisa, that is what will come on your letters. We're not going to worry about that. That will not be a part of the basic training. Same with title. You have some people that are doctor or sergeant or captain. We will not train on that as well. We're just getting in the basic patient information. You'll notice as I navigate, I can push my tab button or move around with my mouse. To navigate through, I'm just going to use my tab in this data. The patient status. There's 3 options to choose from in the patient status. Are they an active patient, a non-patient, or are they inactive? A non-patient may be a parent that does not come to the practice, but we've needed to add them in because perhaps they're the ones who have the insurance. Maybe that's dad and lives in a different state and sees a different dentist. So for our purposes, I'm an active patient. Next is the gender. You can select male or female. And the marital status. In the marital status, you have 4 choices: married, single, child, other. Single would be a single adult, 18 years and older. A child, of course, is a minor. And other might be something that applies to a second parent or a step parent that has the insurance, things like that. So we're doing married. Birth date. Oh boy, I'm going to give this away. When I punch in the birth date, did you notice I put no dashes and no slashes? It's simply month, day, full year. You need to put either 2000 whatever or 19 whatever. Yep, it's the big one this year. Woo! Social Security numbers. Social Security numbers must be unique. If you duplicate a Social Security number from somebody else in the database, it's not going to allow it. So I'll put my pretend one. Remember, no slashes or dashes. I simply put the numbers. It'll automatically put the slashes or dashes in. Other ID. That just happens to be a little section that if a patient doesn't have a Social Security number, maybe they have a state ID, this is not the place for insurance ID. It is not. This is if you need to keep track of your patient with another form of ID than Social Security number. Same with driver's license. You can punch in whatever driver's license you need if you want to keep that data. I'm going to tab again to the address. Very simply, we're going to type in an address. 123 ABC Street. Second line, apartment number 12. You'll notice when I tab and I go to maybe the city or the state, it's blacked out. It does not allow me to type that in. It does this by zip code. So when I type in a zip code, 84003, and press tab, it doesn't have that city in there. So I'm going to simply put in American Fork, Oops, Utah. I'm going to press OK, and now I have a database for that zip code. So if I have another family that lives in that zip code, it'll find it. I can also put in emails. Lisa@me.com. I'll just make that up. I tab to my phone numbers. Something that's important to remember in your phone numbers, Dentrix requires 10 digits for a phone number. You must have area code and the phone number. It will not let you put in just 7 digits for a phone number. So I can put another work number in. I can do extension, best time to call the patient, fax, and mobile or cell phone. Other is just if they have a separate phone number that they like to keep track of. So there's lots of opportunities for phone numbers. Just remember, you must have an area code in. The second area here in our patient database is the office section. This is the office data we need to keep track of. You must assign a primary provider to the family. You must. So we have some primary providers, some secondary providers. I'm going to choose just Dr. Dennis Smith as DDS1. And provider 2 simply means if they prefer or usually see a hygienist. Here's Sally Hayes. She's a hygienist. That's the one I like to see. So you can assign the hygienist they prefer. You do not need to. However, primary office provider 1 is required. That is a must. You'll notice a section called fee schedule. That is not going to be assigned. That is done through insurance. You'll have a chart number that will auto-assign. It will automatically populate today's date as the consent form to be seen is filled in. And first visit will be today. I'm just going to press OK. Okay, here I am on ABC Street. You have my information. You simply, to locate again, the guy with the arrow, now I'm going to look for myself. There I am. And now I can select myself, or I could have carried on. The next section is medical alerts. Medical alerts is this little plus sign. When I click on the plus sign, it's empty. I don't have a medical alert yet. However, I have filled in my health history. So I'm going to edit. And we're going to find some things that perhaps I need. I need to pre-medicate with amoxicillin. And I happen to be allergic to latex. That's pretty important in case we're going to be wearing gloves. And I'm going to go down a little bit more, and definitely I have fainting. All right. Many times a question I am asked is, what if they have a medical alert that is not in the list in the doctor's office you're at? There's another little section that says Other. And I'm just going to select Other. There's something else that I have that's a medical alert, but we'll talk about that in a minute. But I need to mark it. There's something else. So I'm going to mark all of my alerts and close. I now have a red plus sign, that medical sign that we're all aware of. Whenever you see my name in the schedule or in any other place, it's going to have the red plus sign. And I can click on it and access, edit, change, and update my medical alerts. The next section, employer. Now, you'll notice that all of the program for the family files, little blocks or little windows. So when I select the employer, I just pop it open, I double click it, and I can locate my employer. Let's say that I work for Smith. First thing we're doing is to check to see if it's already in the system. It is not. So I'm going to keep it that I work at Smith. I can put in an address. I can put in city, state, and zip. And even the number if I'd like to have it there. So I can run employer reports. I can see all of the patients attached to that employer if there's more. I have now an employer. The next area to the right is continuing care. Now, this continuing care is simply recall. This is the area that should be set for for that patient, especially if there are specifics. For instance, you may be in a practice that has different categories. These are the basics: bite wings, full mouth x-rays, maybe ortho visits, Panorex, perio, prophy, and oral cancer screening or other screenings. Let's say I happen to be a perio patient and I need to be seen every 3 months. I can highlight perio and press set. It's already giving me a due date from today. However, when I select this arrow, the program auto defaults to 4 months. But guess what? I have to be seen every 3 months. So I can simply select 3 months. And this is interesting. Can you see plus a day? In many dental practices and especially insurance companies, if you have a checkup visit 1 day too soon, they're going to deny payment on the claim. That's why it auto defaults to plus a day, just to make sure you just get, the right time frame. The current due date was at 4 months. Now it's at 3 months. I'm going to press OK. I'm going to press OK. Now, I'm one of those people, I do like to still have a prophy every 6 months. Even though I'm a perio patient and they have to do the probing, I want to have my teeth cleaned on top of it, just to show you how to set this. When I go into my prophy, it's showing me due in January because that is 6 months plus a day. I do want to have it every 6 months. So that's exactly how I want it to be. By the way, if you are a standard patient in a practice and you have your 2 cleanings a year that are 6 months apart, it will already automatically update it when a patient has a prophy visit. I'm just setting these so you can see clearly I now have due dates. Now remember, if a patient comes in and has a prophy done and this is not set up, it will ask you, do you want me to set up continuing care? And it will automatically set that up. One last area, something like a Panorex. Some have them every 3 years, some have them every 5 years. So I'm going to set mine. Right now, it's setting me in 3 years. I'm just going to change it to 4 because that's what my insurance allows. And I'm going to save that. So for me, when I have a prophy, it'll let me know I'm due again in 4 years. This is how you uniquely can set up continuing care so the patient will know, and you can run recall reports and continuing care reports to know when patients are due or if they're past due. All right, next section, patient notes. Now, patient notes is one of those things that I want to explain. There are different places in our program to put notes in. Patient notes should be more patient-friendly or patient information, not money or account or payment type of notes. So when I open up this note, I'm going to go ahead and put right in here, let's see, is the doctor's best friend. Okay? There's a patient note. That's going to remind me. I can look at my notes before the patient comes in, and I can clearly see, oh, this one's the best friend. Okay, let's treat her extra special. I could put any other kind of note. For instance, this is another note. Will be out of town for 8 months in Hawaii. Oh, yay. I put a date line so I know when the note was put in. So if I'm due again in 6 months, this note will remind me, oh, she's not back yet. She's in Hawaii. Lucky girl. When I put notes in, this is kind of HIPAA. I can hide or view the patient notes. So if you have somebody lying in the chair and they're looking at the screen, these are the kind of things that you can kind of keep hidden, however you'd like to. Or you can add, edit, change or clear out any old notes you might have on the patient. Remember, this isn't when they say I'll pay $50 next week. This is not the place for that. I will show you that later. Now, referrals. When I look at referrals, we have actually two windows here, referred by and referred to. Now, of course, when you're looking at referred by, and I click this open, there's different ways you can add a referral. Most offices truly keep track of their referrals. I'm going to add a referral. I'm going to add that a patient referred me because I heard it was a great office. I'm going to click patient, and I'm going to look for, Michael Smith. He referred me. Good guy. Also, I'm going to add another referral. I'm going to say that actually the web search, I went online, I have insurance, and this was a doctor recommended. So I'm going to put that in as well. It will keep track of the date of the referral and where the referral came from. Now, when I'm looking at my patient family file, it says multiple. I can click on this, and I can obviously click on a patient, and it'll give me his information or the web search information. Referred to. This is simply if you refer to maybe an orthodontist or an endodontist. Perhaps there's a specialist or a pediodontist. So I'm going to go into add a referral, and we have in here already a provider, Dr. Clark, who's an oral surgeon. We referred me there because I have my wisdom teeth that haven't erupted, and I'm old and I need those out. There's a purpose to this. We keep track of referrals so that a report can be run once a month to see who's referring in and where we're referring to. Okay, now that you have this patient data, there's one last section. Can you see right here it says insurance data? We're actually going to talk about the insurance data a little bit later. We're going to talk about insurance kind of all by itself because it is one of those things that if you keep your mind focused on just insurance, it'll help you to show how to create claims, how to, okay, so looking at my family. Here I am. I'm lovely. Well, guess what? I have a husband. He's not a patient, but he is the one that has the insurance. So this is where I add a family member. I put me at the head of household because I want to get the bills. This is my dentist. I'm the one responsible. But he has the insurance, so I'm going to add a family member. It's going to populate the last name, thinking it's the same. I could change it if that's the case. Philip J., but he goes by Phil. Goodness. No salutation or title we're worrying about. This is important because this will keep track in our patient database who our active patients are and who we might be sending letters to and correspondence. He would be a non-patient. By the way, I'm asked all the time, who is somebody who's inactive? That could be somebody who's moved away for a time. There's a whole different area that perhaps somebody has passed away. You can archive them. But in this case, non-patient. We're going to tab right to the gender, which is male, tab to the marital status, which he is married. We'll put his birth date in as well because I may need that for insurance purposes. And if I need his Social Security for, again, insurance purposes or anything like that, I can put that in. Again, other ID is if I need a state ID or something else, military ID, anything you want to put there. Can you see it automatically populates the address? Automatically because it's attached to me. I can choose to put email in or not. If that's a person that's maybe a non-patient that I do not need to contact, probably not. And on phone numbers, it just put our home phone number in. Obviously, he may have a different work number that I can fill in. He may have a different cell phone, and so on. We're just going to keep the home number since he's a non-patient and I will not need to be contacting him. It also automatically defaults in the office provider. It still has to be assigned in order for Dentrix to accept it. So it is the same family with the same provider. However, you go a little farther down, consent form date is grayed out because he's never walked in the door and has not signed anything, and he has no visits. So I'm going to press OK. All right, families will come linked at the bottom. I can click Phil's name and have his data appear. I can select my name and my information appears with all of my data. All right, we're going to go back to me. There's one more thing I need to show you in the family file. There's a lot of little buttons up here. A lot of these we're not going to be concerned about. However, there is this little guy holding a flag. I know it looks like a butterfly net. It is a flag. It's an alert. There's a couple of alerts I need to put on me. There's a few things that I really want to make sure that we remember. First of all, how long do I want this alert to appear? It's going to default to a year. You know what? I have an alert for you that I always want to show no matter how many years I'm there. I want to show my alert on my appointment so I can clearly see there'll be a flag there. I'm not worrying about money on the account. Here's my big alert. Must pre-medicate. That's pretty big. I want to make sure everybody sees that. So when I schedule an appointment, it's going to pop out at everybody's eyes that I must pre-medicate. Down below, you have a note field. I'm going to move this a smidgen. I'm going to put a date line as to the day I put the alert in. That way it will help actually, maybe it's something I can update later if something has changed. Okay, so I'm going to put must pre-medicate with, I think I put erythromycin, maybe it was amoxicillin. Okay. Allergic to erythromycin or whatever. Remember, was that other one? Erythro. Okay, good enough. I have created an alert that will pop out, and you'll see this as we go on through the whole program. There's this huge list on the right side. The patient alert should be displayed where? Well, let me see. If I am creating continuing care, I want it to remind me, oh, they need to pre-medicate. If I'm creating an appointment, it better remind me, need to pre-medicate. Edit an existing appointment. That's pretty important. If I enter payments, that has nothing to do with money. If I'm putting a note in there about money, that has nothing to do about pre-medicating, and so on. So at this time, I'm only going to choose for this to pop out at me when I'm having appointments, so it'll remind us to pre-medicate. Okay. I'm also going to put another alert. Can you see now we have this yellow flag? I now have alerts on me. You know what? I need to do another alert. So I'm going to open it and press New. This time, I'm going to put a different note. This is going to be always and show the symbol. I am pretty picky about my hygienist, and I always want to schedule with Sally. I'm just going to write it down, so hopefully when I'm scheduling an appointment or they're calling me, I'll make sure I'm scheduled with Sally and not the other hygienist. Prefers Sally for hygiene. I'm just going to put this everywhere because I want you to see the difference on where you're going to have these pop-outs happen. That is a couple of patient alerts I want to put in there. Do you remember in my medical alerts I had other? Maybe I'm allergic to peanuts. maybe it doesn't matter, but you want to document those things. So that could be a good place in my patient notes. I'm going to put it at the top. I want to keep it documented somewhere so I know the patient told me. So again, that's one of those things where I can put in my patient notes, oh, they're allergic to peanuts. Yeah, I better remember that because this says other, and I don't know what it was. That's a good place to put that. All right, I have filled in my information for my patient data. I've also added a family member. That actually will conclude this part of the whole family file. If you've had any questions, hang on to those. We're going to do 2 more sections and then have a question and answer time where we can literally answer any in the categories we're looking at. I know you have your outline, so we've finished family file. Next will be the appointment.